Percentage of Americans without health insurance is higher today than in 2008. Let me repeat that. There are more uninsured in 2014 than when Obama began his takeover of 1/6 of the U.S. economy. That's according to the most recent Gallup poll. In 2008, the number of uninsured was well below 15%. Right now, close to 16% of Americans are without health insurance. And here's something really alarming. The number of Americans with insurance through an employer fell from about 45 to 43%. Meantime, medical offices around the country are dealing with the high cost of Obamacare, and in Texas, one medical facility has no choice but to lay off staff.
The new policies are changing how hospitals get paid by the government. So Hamlin Memorial now and others may later are making several budget cuts, including laying off the 6 people. Those employees were nurses who worked in the support services department.
The reimbursement to the hospital by insurers, those reimbursements continue just to decline, and you couple that with a out-migration of the population in these small communities, it hurts the hospital tremendously.
Rudy.
Hamlin Memorial expects to save an estimated $400,000 a year by firing the nurses, eliminating overtime and schedule changes, and making other cutbacks.
It's happening all over the country. Now, the negative effects of Obamacare are like tentacles on a grotesque octopus. Example, there's a new initiative by the Department of Health and Human Services that may prevent people from even seeing an actual doctor. So how in the world is this possible? Joining me now, private medicine advocate and Obamacare expert Patricia Newman. Patty, there is a difference, of course, between seeing a doctor and, by the way, a doctor in the proper field versus a so-called, quote, healthcare provider, and we should care about the difference, correct?
Absolutely. In fact, the AFP just had a survey that was published last month, and it was February of this year, showing that the majority of people, when they have a medical question, they will go to a family practice physician 41% of the time to get that answered. They go 21% of the time to any physician, 8% of the time to a subspecialist, and only 3 and 6% of the time will they seek advice from a nurse practitioner or a physician assistant. So obviously patients know the difference. However, the government is trying to get us used to this concept of medical provider. This is one of those Alinsky kind of progressive tactics to get everybody used to the new nomenclature and try to use the terms interchangeably as if a physician was the same as a PA, because they see the shortage of physicians in the future.
Right, and they're also talking about it, correct me if I'm wrong, but if you can go to say for example, a podiatrist for some sort of eye infection. I mean, that's the kind of stuff we're talking about too, because Obamacare knows that A, there's going to be a doctor shortage, and B, the doctors are not going to be able to handle all of the people, the proper doctors anyway.
Right. You know, this last week, Dr. Ezekiel Emanuel was talking to O'Reilly, and he was saying, look, you don't need a doctor in in all of the medical cases. That is to get you used to the idea that you won't have enough doctors. Deloitte, the consulting firm, said that out of the 800,000 physicians currently practicing, there's about 44% of them that will stop practicing medicine. They will, they called it an opt-out, and Dr. Emanuel said, well, they can't opt out of these contracts if they're part of the contract. Well, that's sort of true until the expiration date of that contract comes to fruition. But in the meantime, they can close their practices. They can retire early. And if you see a shortage of 44% of physicians, then of course you have to get used to the idea that other mid-level providers will take care of your medical care. The problem is, and for those, I don't have any problems personally with mid-level providers as long as they're supervised by a physician. But those in that profession that are celebrating the fact that they're going to get the bulk of patients, they need to think that in the future, when, for example, a strep test is sold over the counter and the pharmacist or the podiatrist or whoever else, if it's positive, they'll be able to prescribe and leave them out of the equation. This is what happens when you centralize healthcare and make it universal.
Another thing is, and you mentioned Alinsky there, Saul Alinsky, and the whole rules for radicals and turning this country into a socialist country, is something called social usefulness. And that is, unfortunately, although it may not say it exactly in those words in Obamacare, it's embedded in there. And to me, it means is, hey, if you're older and you need knee surgery or hip surgery, and this other person is younger and needs that same surgery, hip or knee surgery, the older person is going to get a lower priority, period, right?
Right. Well, when the government's in charge of paying your bills, the government needs to do the math. And, we have seen historically that 10% of the sickest, oldest people take 64% of the expenses of health care, and the young people only spend 3% of that money. Then the government has to figure out how to allocate the resources. This Dr. Emanuel, which I have a problem calling him a doctor. He published an article on The Lancet just in January of 2009, and he is promoting what is called this complete life system. And in that system, they think that adolescents have more value than old people and even newborns, because you've invested time in their education, in their training, where a newborn, you haven't spent that part of your parental resources, and old people have already been young. So they are promoting this social usefulness allocation of medical resources, and this is the man that's called the architect of Obamacare. So you can see where we're going.
And he's also the brother of Rahm Emanuel, who was the chief of staff of Obama, and both those Emanuels ought to go back to Red China, where they came from, in my opinion. Patty, thanks.
Thank you.
Coming up next, what the Clinton Library could be hiding as the Daily Ledger continues.
He's an award